In this video, you'll get a quick overview of Vibrant's immune zoomer. I'll walk through each section of the test, highlighting key features. Then I'll explain the technology used and briefly discuss collection instructions. I'll also suggest synergistic tests. And I'll end by highlighting the Vibrant advantage and where to go for additional information. Approximately 5% of the worldwide population is affected by autoimmune diseases, affecting nearly 10 million people in the US alone. Autoimmune diseases are still difficult to treat, impose a high burden on patients, and have a significant economic impact. Like other complex diseases, autoimmune diseases develop over several years. Biomarkers allowing us to predict this progression may have a significant impact on disease treatment and prevention. The immune zoomer focuses on the early immune signals that shape how you feel today and how your health progresses over time. It brings together tissue-specific autoantibodies from multiple organ systems into one organized profile, making it easier to see where immune stress is emerging. These insights support proactive, personalized plans to calm inflammation, protect vulnerable tissues, and strengthen long-term immune resilience. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The immune zoomer report includes a cover page, description, introduction, a summary with interpretation, and then ends with a list of all markers. The cover page identifies the sample type and includes the results interpretation key. The next page describes the purpose of the test. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially if you want to learn about the methodologies used or how reference ranges were established. The summary shows the elevated and moderately elevated results, along with a comment and interpretation. And the full report lists the levels of all 63 markers, including blood vessels, central nervous system, dry eyes and mouth, eye antigens, gut antigens, immune health, inflammation, joints and arthritis, kidney, liver, mixed connective tissue, muscular system, pancreas, peripheral nervous system, skin, thyroid, and systemic autoimmunity, including ANA, stands for anti-nuclear antibodies. The results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. In this example, the patient has normal antibody levels to the peripheral nervous system antigen ganglioside GM1. However, this patient has moderately elevated antibodies to levels of MAG, myelin-associated glycoprotein. For most markers on the immune zoomer, the reference range indicates normal antibody levels are less than or equal to 1.0. Note some antigens have lower reference ranges, as is the case for tissue transglutaminase (TTG) and deaminated gliadin peptide (DGP). Meanwhile, other antigens have higher reference ranges, as is the case for thyroid antigens thyroglobulin (TG) and thyroid peroxidase (TPO). ANA is reported as either negative or positive, and note that initially the sample is diluted to 1 to 40 for ANA testing. If the ANA result is positive, Vibrant dilutes further to 1 to 80, then 1 to 160, 1 to 320, 1 to 640, and 1 to 1280 for reflex testing. And if positive, the pattern will appear here, either speckled, nucleolar, rim, cytoplasmic, centromere, or homogeneous. If you want to learn more about antigens that are outside the reference range, you can scroll back to the summary and read the interpretive comment. The interpretive comment includes the clinical significance, associated damage, and suggested supplements. In this example, fish oils rich in omega-3 fatty acids reduce aquaporin-4 antibodies by modulating the immune response and reducing inflammation. Now, let's talk about methodology. Vibrant uses a proprietary protein microarray to quantify autoimmune antibodies. To help you better understand this methodology, I will explain how Vibrant makes the 3-dense microchips used to run this test. But first, please note that the microarray utilizes ELISA methodology. However, instead of 1 antigen per well, Vibrant can measure up to 100 antigens per well. Looking at steps 1 through 3, this is possible because Vibrant attaches antigens to silicone semiconductor wafers. This allows for bulk manufacture of thousands of identical chips per wafer, creating the ability to scale to volume. By repurposing many of the techniques used by the computer chip manufacturers, Vibrant can mimic the advantages seen in the computer industry, significantly improved quality and performance while consistently driving down costs for everyone. Looking at step 4, Vibrant dices the wafers into tiny microchips. In step 5, Vibrant uses automated machines to arrange the microchips, one for each antigen, in a 10 by 10 grid atop one pillar on a 24 or 96 pillar plate. The pillar plate is then flipped upside down and submerged into the well of the patient's blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Again, each pillar can measure up to 100 analytes because it's a 10 by 10 grid. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. In summary, this automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Finally, let's review the collection process and key preparation considerations for immune zoomer testing. Vibrant's immune zoomer is a blood test. Blood can be collected via blood draw, usually done by a phlebotomist. Or, if ordered via the at-home menu, blood can be collected via dried blood spot, commonly referred to as DBS. A detailed video of how to collect DBS sample is linked in the video description, which can be shared with patients who require a full walkthrough. As for timing and pretest conditions, blood samples may be collected at any convenient time of day, unless otherwise instructed. Fasting is not required. However, for optimal and clinically relevant results, patients should maintain their normal routine, medications, and supplements unless specifically instructed otherwise by their healthcare provider. As with all testing, patients should consult with their healthcare provider before making any lifestyle changes, including changes to prescribed medications, dietary restrictions, or supplements. Before I share synergistic tests, I'd like to introduce you to Dr. Sidney Baker's Tack rules. Rule number 1. If you're sitting on a Tack, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 Tacks, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to Vibrant's immune zoomer, also consider the gut zoomer, which clarifies whether dysbiosis, barrier stress, or gut-driven immune activation is amplifying systemic or tissue-specific immune patterns. Also, hormone zoomer, which adds endocrine context, helping determine when immune activity tracks with thyroid dysfunction, cortisol rhythm disruption, or sex hormone shifts. And the cellular zoomer, which explains downstream effects connecting immune burden to cellular energy strain, oxidative load, detox pressure, and neurochemical stress. And finally, the nutrient zoomer, which evaluates immune resilience inputs by showing whether nutrient status and utilization are supporting or limiting immune regulation and recovery. In summary, the immune zoomer uses highly specific and sensitive microarray methodology to go beyond systemic autoimmune signals by delivering tissue-targeted immune mapping, measuring 63 specific autoantibodies and antigens, providing multi-system immune insight. This comprehensive test enables clear direction when routine immune labs are inconclusive, including earlier recognition of tissue-focused immune stress, supporting more targeted, lower-burden care planning across multiple system symptoms, providing better longitudinal tracking of immune shifts, flares, and response to care. To learn more, visit the links in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.